Think you've got type 2 diabetes all figured out for nursing school? Let's see how you feel after answering these NCLEX style questions that fool most nursing students. Because it's not just knowing what's the therapeutic effect of metformin or this is how you manage hypoglycemia. It's about learning how to think like a nurse about these topics so that you can correctly choose the most correct answer on every nursing school question. That's why in this video, I'm going to walk you through real NCLEX style practice questions about type 2 diabetes. But I'm not just spoon feeding you the correct answer. Instead, I'm showing you how to break down each answer option step by step and start connecting the dots for yourself. It's the only way you can finally be confident that your study strategy is matching the way you're being tested. Let's dive in. Although it would be nice to memorize everything you need to know about type 2 diabetes and be able to prioritize your nursing actions, that's not the way it works on NCLEX or your nursing exams. Let me show you a better way to think about test-taking questions when it comes to type 2 diabetes. Question 1. A client with type 2 diabetes is prescribed metformin. Which instruction should the nurse include in the client's teaching plan regarding this medication? We start by asking, what do we need to know before we can answer this question? In this case, we need to know what drug class is metformin. Do you know about my prototype method for studying medications? Because it's the fastest way to study that cuts down on the amount of studying you have to do. I should probably do a video on that. If at least 3 people in the comments tell me they want a video on how to study pharmacology, I'll make one for you. But metformin is one of the anti-diabetic agents. And this particular subclass has 3 main effects. First, it reduces gluconeogenesis, a word you might remember from microbiology or anatomy and physiology, or not. In normal gluconeogenesis, the liver produces glucose from scratch when the body needs it. Metformin prevents the liver from doing that, thereby lowering blood glucose. Second effect of metformin is it decreases glucose absorption in intestines. That means all the food that you're eating that turns into blood sugar goes out your bottom instead of into your blood. Not all of it, just more of it. The third effect is metformin improves insulin sensitivity and glucose uptake in the peripheral tissues. Basically, it helps insulin do its job a little better so that more glucose can get into the cells, especially in our peripheral tissues. It's important to note that this medication only works with type 2 diabetes, not type 1. Type 1 doesn't have any insulin, so the metformin can't help insulin do its job better, which is why metformin cannot be used in type 1 diabetes. Now, what's the question really asking? We're looking for something we'd teach about this medication. Let's go through the answers. A, take this medication on an empty stomach. If you did not specifically memorize how to take metformin, you might not be sure whether to keep or eliminate this answer. However, if we remember that the purpose of metformin is to help reduce blood sugar and we're taking it on an empty stomach, we may be concerned about the possibilities of low blood sugar if we haven't eaten anything when we take the medication. So we'll keep it for now, but we don't love this answer. B, you may experience weight gain with this medication. This is not something we would expect. Weight gain often happens in type 2 diabetes because the body is having difficulty using the insulin and processing the blood sugar. But once you start on anti-diabetic medications like metformin, you often see the weight gain reverse and you can lose weight because your body is being moved closer to the normal way insulin and glucose should be functioning. C, this medication helps improve insulin sensitivity. This is definitely true. This was one of the 3 effects that we understood happened because of the mechanism of action of metformin. Therefore, we can feel pretty confident that this is the correct answer, but let's check the last one just to be sure. Metformin can cause low blood sugar levels. This is a tempting one because remember that third effect was that it helps insulin do its job better so that blood glucose can be taken up by the peripheral tissues more. And if you haven't already been studying with the Silver Bullet study system to feel confident about understanding that this is the mechanism of action and this directly ties to how metformin works and why it works, then you might second guess yourself and get confused and switch your answer to this instead. But we've been studying with the Silver Bullet study system, and we know that because metformin is helping the insulin sensitivity, it's helping the insulin do its job better, the body is not going to be overproducing insulin. Therefore, metformin can only perform as well as the insulin that is there. And the body is not going to overproduce insulin to drop the blood sugars too low. Maybe theoretically, metformin could cause low blood sugars. It is not likely. It is not predicted. Whereas C is directly tied to what metformin does. And C is the answer. Question 2. A nurse is educating a client with type 2 diabetes about foot care. Which statement by the client indicates a need for further teaching? What do we need to know? It's tempting to think, oh, I should have memorized everything about foot care. But you can't do that. That's going to stress you out. And then you never feel like you're done studying. And what if I forgot something on the caption of page 329? It's better to understand, why do we care about foot care? Because if we understand why we would be concerned and how type 2 diabetes plays a role in that, then we can practice thinking about how everything connects, and we can come up with any answer we need to on the test. That's what I mean when I say you got to learn to think like a nurse. The question is asking what indicates a need for further teaching, so we know we are looking for an incorrect response by the client. There's going to be 3 correct statements about foot care and 1 incorrect statement. A, I will inspect my feet daily for any cuts or blisters. This sounds good because type 2 diabetes over time can lead to peripheral neuropathy because that high blood sugar is damaging all the little tiny blood vessels, which then ends up damaging the nerves. This means our sensitivity in our periphery, like our toes and our feet and our fingers, is decreased. So if you get a cut or a blister, these clients may not even realize it. They can't feel it, which means they won't take care of it. It might get dirty. It could get infected. It could lead on to complications like gangrene, even amputation. So inspecting your feet daily helps pick up on any cuts or blisters you didn't even notice happened. This is a correct statement. B, I can walk barefoot at home as long as I am careful. This is a good distractor because if you're being careful, what's wrong with being barefoot? I love being barefoot, personally. I'm barefoot right now making this video. However, when we are barefoot, it's easier to step on things that might cut. And as we discussed in the first answer option, we might not even feel that our foot is getting cut. So this answer option is a little concerning. We may want to protect our feet and not be barefoot, even if it's at home. But we're not sure. Let's look at the other answer choices. C, I should wear well-fitting shoes to prevent sores. That sounds like good advice. If they're too tight or too loose, they could lead to blisters. And we know blisters, if they're not noticed, could lead to infection. This sounds correct. D, I will keep my feet clean and dry, especially between the toes. Why would this matter? This goes back to fundamentals of nursing and skin integrity. If you have accumulated dirt and moisture, if the skin is chronically wet, moist, it can reduce the skin integrity. And especially when this happens in between the toes, this can lead to an overgrowth of fungus, and it can also increase the risk that the skin could break and experience a tear. And we want to avoid that. So keeping it clean and dry is going to help with skin integrity, which will prevent cuts. Therefore, B still sounds like the best answer, and that is correct. Question number 3. The nurse is reviewing the laboratory results of a client with type 2 diabetes. Which of the following lab values indicates that the client's blood glucose levels have been well controlled over the past 3 months? In this question, we need to know a little bit about type 2 diabetes, what the pathophysiology is, and what sorts of lab tests we would do to evaluate their blood glucose management. What the question is asking is which of the following lab values show us how their blood glucose has been managed and indicate a positive result. Answer A, fasting blood glucose of 180 milligrams per deciliter. Tempting, but only because it says blood glucose. If you know what normal glucose levels are, then you will know that this is way too high. That is not well controlled. Not only that, but a fasting blood glucose only tells us how your blood glucose is doing today, right now, before you have eaten. It does not tell us how well controlled it has been over the past 3 months, like the question is asking. We can eliminate A. B, hemoglobin A1C of 6.5%. Hemoglobin A1C is the lab that we are looking for when it comes to control for the past 3 months. This lab value increases the longer that blood sugars are high. Therefore, if blood sugars are well controlled over 3 months, hemoglobin A1C will be in the normal range. If blood sugars are chronically high over the course of 3 months, more of them are going to kind of stick to the hemoglobin, which makes the hemoglobin A1C high as well. Now, I need to point out that on the NCLEX NGN, if they ever give you a lab value, they will always give you the normal range. Not every nursing school has caught up to this requirement, however. So as a professional nursing tutor, I do recommend that you still memorize the normal ranges. It's also good just to kind of have that floating around in your head when you're glancing over lab results. And in this case, A1C, if it's under 5.7%, that is considered normal. So 6.5% is still on the high side. We might think this does not represent well controlled. However, there is an alternate normal range for people with diabetes, and that is under 7%. 6.5% is definitely under 7%. Therefore, this is actually considered well controlled for the past 3 months for a type 2 diabetic. this is going to be our correct answer. However, we still like to go through all the answer options just to make sure we have a good rationale for why the wrong answers are wrong, because that helps us be confident in our choice. Hemoglobin A1C of 8.5% is clearly high. This is above the 7% cutoff, even for somebody with diabetes. And then D is random blood glucose of 200 milligrams per deciliter. This does not tell us a whole lot other than maybe they ate recently or maybe they have diabetes. We do not know because it's a random blood glucose. This is only a snapshot. It is not an average of the past 3 months. Therefore, our answer choice is B, hemoglobin A1C of 6.5%. Question number 4. A client with type 2 diabetes is experiencing symptoms of hypoglycemia. Which of the following actions should the nurse take first? What do we need to know to answer this question? We need to know what causes hypoglycemia. You're probably jumping saying, no, Nicole, I just need to know what the symptoms are. If you memorize them, maybe you'll get this right, maybe you won't. How is that going to help you prioritize the nursing actions? It's better to understand what is normal when it comes to blood sugar, what changes or breaks with hypoglycemia, and then you can just figure out the symptoms and figure out the nursing care in any situation, no matter what they change, no matter what they try to trick you with. That's the way I teach you to study so that you can do that on the exams, and then you can go on and do that as a nurse later on. And then it's asking us to prioritize our nursing actions. Let's look at the answer choices. A, administer glucagon intramuscularly. This answer sounds great. Glucagon is going to be a form of sugar. It's going to increase our blood sugar. Therefore, if we think that the client is experiencing hypoglycemia, we know that we probably want to give them sugar. We like this answer, we're going to keep it, but we always go through all of them just in case there's something better. B, give the client 15 grams of fast-acting carbohydrate. Oops, this sounds good too. You know why? Because this is also going to increase our blood sugar. Therefore, this is also something we would give for hypoglycemia. Now, how do we prioritize between these two? Because now that we have two that could potentially be correct, we have to decide which one is the priority. Which one should the nurse do first? And in this case, we would prioritize because we want to choose the least invasive. Giving something by mouth is going to be less invasive than giving an IM injection. Therefore, even though A and B will both help with hypoglycemia, B would be the priority nursing action to take first, because if this works, we don't need to give an IM injection. So we're going to throw out A and keep B, but continue through just in case there's something better. C, call the healthcare provider. That's not better. We always throw this one out, right? Because if you call the healthcare provider, the first thing they're going to say is, what did you do for the hypoglycemia? And then you're going to look like an idiot. Cross out C. D, check the client's blood glucose level. Ooh. Here's a little different one. Between checking the client's blood glucose level or giving the client 15 grams of fast-acting carbohydrate, which is the first nursing action to take? Now we get into a different set of prioritization because the fast-acting carbohydrate, is a nursing implementation, whereas checking the client's blood glucose level is a nursing assessment. Now we have to decide, do we need to prioritize assessment in this situation or implementation in this situation? And to do that, you have to think back to your step 1 normal from your fundamentals of nursing class. I keep telling you this stuff comes back to haunt you. Study it right the first time with the Silver Bullet study system. And if not, that's okay too. I teach students how to go back and fill in knowledge gaps as you go so it's not overwhelming. Let's check back at the question to make sure we're not missing anything. It says the client is experiencing symptoms of hypoglycemia. Believe it or not, that's subjective assessment data. Remember the difference between subjective and objective? They may look like they have hypoglycemia. They may tell you they feel like they have hypoglycemia, but as a nurse, we do not yet know that they actually have hypoglycemia. Therefore, we do not have enough assessment data to verify they have hypoglycemia and take action. It could be something else causing those symptoms. And if so, we could make things worse by administering the carbohydrates instead of investigating further. Therefore, the best answer is actually to check the client's blood glucose level. Once we have verified that the blood glucose level is actually low, then we would give the client 15 grams of fast-acting carbohydrate. If for some reason that didn't work, we could move on to administering glucagon intramuscularly. What do you think? Do you agree? Or do you want to argue with me? I love this question because it represents two ways of prioritizing in the same question. A great example why you can't simply memorize. what to do when somebody has hypoglycemia, because the answer is it always depends on the situation. If you now realize you're relying too much on memorization and not enough on actually understanding and thinking like a nurse, then head on over to this video over here so I can teach you the silver bullet study system and you can think through these questions as easily as I can. Or if you're ready to test your knowledge on type 1 diabetes questions, head on over to this video over here. Before you go, tell me in the comments, how many questions did you get right? I'll see you in the next video.